Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, and I'm going to be going over pneumonia. This video is specifically for the LPN/LVN student. However, if you are an RN student, it will still help you because you still need to know this information. It still applies to the type of questions that you will be getting. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video, subscribing to my channel if you haven't done so already. And guys, don't forget, I'm now offering next generation NCLEX reviews and private one-on-one tutoring sessions and consultation sessions. Maybe you're in the nursing program and you're struggling with something, or you're trying to get into the nursing program and you just need some advice. Okay, so I offer consultations and one-on-one tutoring sessions. You can reserve your spot by going to my website, nexusnursinginstitute.com. Now, without any further ado, guys, let's get started. Pneumonia. To determine whether pneumonia is caused by a bacteria or virus, you asked about the onset of symptoms. What's the rationale for this? Is it that symptoms of bacterial pneumonia present rapidly and they're more severe? Or symptoms of pneumonia present rapidly and they're more severe? Symptoms of viral pneumonia begins a few weeks after an upper respiratory infection, something like, a cold, a sore throat, stuffy nose, or symptoms of bacterial pneumonia begin a few weeks after an upper respiratory infection, again, such as cold or sore throat. So when you're determining whether pneumonia is caused by a bacteria or a virus, and you ask the patient about the onset of symptoms, why are you doing that? What is the rationale behind that? Okay, good. 8 of you chose the correct answer, but 8 of you chose the wrong answer. So let's talk about this. So anyway, when you're trying to figure out just from the clinical manifestations, if it's most likely bacterial or most likely viral, your key is going to be the onset. Okay. When it comes to bacterial pneumonia, the onset is much quicker. It's more harsher. The clinical manifestations are worse. So what happens is a patient will have an upper respiratory infection, and the incubation period can be hours up to 2 days versus viral where it'll take longer. Okay. So that's why this is the correct answer. Symptoms of bacterial pneumonia present rapidly and they are much more severe than viral pneumonia. You give ice chips to your patient that is mouth breathing. How would you calculate the amount of ice the patient swallowed? Would it be to subtract the volume of ice left in the container? Would it be to melt the same amount of ice and measure that volume? Would it be the amount should be small, so there's no need for measurement? Or record the volume as small, medium, or large? Wow, most of you guys chose subtract the volume of ice left in the container. No, guys, listen. So the volume of ice is going to be half as much when melted. So what you're going to do is melt that same amount of ice and measure the volume because the volume is half when melted. And so whatever the amount that patient ingested, you want to be as accurate as possible. I'm happy I'm doing this Kahoot. So you're checking your patient's pulse oximetry measurement. For which reading would you administer oxygen? Would it be 97%? Would it be 95%? Would it be 88% or 89%? You're checking their pulse ox, the SaO2. Which measurement would indicate that patient needs oxygen? You need to place oxygen on them. 97, 95, 88, or 89? Wow. Okay, so let's talk about this because only one person got this right. The SaO2, that's the pulse ox, right? Normal reading, if it's normal, it's going to be between 95 and 100. In a perfect world, we'd want it 98 to 100, but anything 95 or higher is acceptable. Once that patient hits 91% or less, they are now in respiratory distress. So let's go through these because I want to make sure you guys understand this. 97% wouldn't be the answer. We don't need to give them oxygen if they're at 97 because remember, 95 to 100 is normal. We don't need to give them oxygen at 95 because 95% to 100 is normal. Remember, I told you once that patient hits 91 or lower, they are now in respiratory distress. So why would we pick 80, 88? We're going to wait until they get to 88. Out of these choices, it would be 89. Guess what? If 91% was there, it would have been 91. Once that patient hits 91, they are in respiratory distress. Make sure you guys know this. You're expected to know it. Okay, your patient's having difficulty expectorating sputum. Which action would be most appropriate? Are you going to encourage the patient to increase fluid intake? Are you going to encourage them to change positions frequently? Are you going to ask the dietitian to send clear liquids? Or are you going to give an antitussive before sputum collection? What are you going to do? Very good. You're going to encourage the patient to increase fluids. And the reason for that, guys, fluids help to thin the secretions. So it's going to be easier for them to move the secretions and actually cough them up. That's why you want to encourage fluid intake. Now let's look at the wrong answer choices. 5 of you chose encourage the patient to change positions frequently. Well, what changing positions frequently is going to do, because secretions like to just sit there and accumulate in the lungs. And you know, any fluid that doesn't move is a perfect medium for bacteria, right? So getting them to change positions frequently, that's a good thing. You want to move those secretions. Here's the problem. If those secretions are thick, and they are, that's why the patient has a hard time expectorating, coughing them up, you can move them as much as you want. If nothing has thinned those secretions, they're still not going to be able to cough them up. So you want to give them lots of fluids to thin those secretions so that'll be easier to cough up. One person chose, ask the dietitian to send clear liquids. You cannot do that as the nurse. It is a healthcare provider that orders the type of diet that patient is on. And last, give an antitussive before sputum collection. Guys, the antitussive, that actually makes you not cough. It's an what's the word for anti-cough? I'm trying to think of the medical term. Guys on the live, I can't think of the word. What is it for the antitussive? It's going to come to me. Anyway, antitussive, what it does is it suppresses the cough. Why would we want to suppress a cough in a patient that's having trouble coughing up the sputum? Look at the question. It says the patient's having difficulty expectorating sputum. That means they're having trouble coughing up the sputum. So why would we give them something to suppress the cough? That makes absolutely no sense. So that's why giving them fluids is the correct answer choice. True or false? When using an incentive spirometer, the patient must exhale slowly and deeply. Is this true or is this false? What do you guys think? This is false, guys. This is false. So the reason a patient would use an incentive spirometer is they want to help the lungs to expand, right? You want the lungs to get stronger. You want the lungs to expand. So when using an incentive spirometer, the patient is going to what? Take a deep breath. We want them to take a deep breath, and they're going to do that slowly and deeply. And after they take that deep breath, you want them to hold it for 2 to 6 seconds before they go ahead and release it. Okay, so they're breathing in slowly and deeply because we're trying to increase the expansion of the lungs, and they're going to hold their breath for 2 to 6 seconds afterwards. So this was false. They're not breathing out, they're breathing in. When would be the best time to obtain a sputum specimen for your patient that has pneumonia? When would be the best time? Would it be before bedtime? Would it be after a meal? Would it be between meals? Or would it be upon awakening in the morning? When's the best time to collect sputum specimen? Very good. Upon awakening in the morning. And the reason for this, guys, is while you're sleeping, those respiratory secretions, they just sit there and they pool because you're not moving. Remember in a couple slides ago, I was telling you how moving is good because it keeps the fluid from just sitting there. And remember, any fluid, whether it's secretions, whatever, anything that just sits there, bacteria grows. While you're sleeping, you're not moving, so the secretions just sit there. So upon awakening, the patient just woke up. This is when they're going to have the most energy because they weren't doing anything but sleeping for a couple hours. So they're going to have the energy to cough up those secretions. Remember, when you're trying to collect a sputum specimen, you're going to teach them not to spit. You don't want those secretions from the oral cavity. You don't want the secretions from the mouth. You want the secretions from the respiratory tract. So you're going to teach the patient to cough it up because that's the type of fluid that you want. Okay. So it's correct in the morning, when they wake up, before they eat anything, before they have anything in their mouth, that's when you want to get it. Which assessment finding would make you suspect that your patient has now developed pleurisy as a result of pneumonia? Would it be a productive cough? Would it be pain when breathing? Would it be peripheral cyanosis, or would it be tachypnea? Which assessment finding would make you suspect that your patient has now developed pleurisy? How are you guys doing on the live? Correct. Pain when breathing. So let's talk about what pleurisy is. Pleurisy, guys, is inflammation of the pleura. It's inflammation of the lung lining. And that is a possible complication of pneumonia. And so the patient who has pneumonia, when they have pleurisy, that pain it's usually described as like a sharp stabbing pain upon taking a deep breath. So your patient who already had pneumonia, if they're all of a sudden complaining about pain just breathing, you should suspect that the patient's now experiencing pleurisy. Now let's look at the wrong choices. Productive cough. Well, guess what? The patient's going to have productive cough with pneumonia. What we're looking for is a complication of pneumonia, which is the pleurisy. So it wouldn't be productive cough because they would most likely already have that, but they wouldn't have the pain on breathing unless they develop pleurisy. Let's talk about peripheral cyanosis. So peripheral cyanosis, that would be a sign to us of, the patient having decreased perfusion. There's decreased oxygenation, right? But not so much pleurisy. And of course, tachypnea. When you see those respirations go up, that lets you know the patient's having difficulty with oxygen in their system. But this question is specifically about pleurisy. And the only one that answers that would be the pain when breathing, specifically when they take a deep breath. Which immunization would you encourage your patient to receive annually? I'm sorry, I spelled immunization wrong. Forgive me. But anyway, which immunization would you encourage your patient to receive every year? Would it be the Zostavax, Pneumovax, Prevnar 13, or Fluzone? And I spelled Fluzone wrong as well. No, actually, that's correct. The medication is Fluzone, not Fluzone. My apologies. Let's talk about this, guys. 19 of you guys fell for it, and this was a trick question. 4 of you chose the correct answer. So the correct answer, which is the Fluzone, this is for influenza, the flu, right? But I want to talk to you. The question said, which immunization, and we're talking about the patient that has pneumonia, right? Which immunization would you encourage your patient to receive annually, every year? So you are going to teach your patients to get their flu shot every year. Let's talk about the other choices. So first, the Zostavax, that is for varicella. That's the vaccine for the patients that has already gotten the chicken pox, all right? So that's not the answer. Let's talk, and I'm happy nobody chose Prevnar 13, but let's talk about the Pneumovax and Prevnar 13. Prevnar 13, that is for the pneumonia, but that's given at 2 months. It's given 4 times, 2 months, 4 months, 2 months, 4 months, 6 months, and then around 12 to 15 months, right? That's the Prevnar 13. After that 4th dose, about a year later, that's when the patient takes the Pneumovax. And it's not annually. This question was asking you about annually. So the only correct answer was the flu shot. And let me tell you something. Any patient that has had pneumonia, has respiratory issues, or immunocompromised, your patients with COPD, your patients with asthma, your patients with Guillain-Barré. By the way, let me back up. COPD and asthma, these aren't patients that are immunocompromised, but these are patients that have respiratory issues. And if it's bad enough, they can become immunocompromised. But anyway, patients with autoimmune disorders. Now, the patients with autoimmune disorders, those would be your patients with, you know, Guillain-Barré, lupus, myasthenia gravis, other patients who are immunocompromised, HIV patients, patients who's getting chemotherapy, radiation. So anyway, anyone who's immunocompromised, anyone who has an autoimmune disorder, you're going to teach them to get their flu shot every single year. That is very important. Oh, I forgot somebody, sickle cell. Sickle cell, that's a biggie. NCLEX loves to ask about that, so don't forget. Make sure you guys know that. You're giving ordered penicillin intramuscularly for your patient with pneumococcal pneumonia. Your patient asks why. What would be your answer? Would it be the sensitivity report showed the organism is often killed by penicillin? Would it be most viral infections respond well when treated with penicillin? Would it be penicillin is one of the safest and most effective antibiotics? Or would it be that all antibiotics are similar and the choice of drug really makes no difference? Oh, wow. All right. We're going to have to talk about this as well, guys. When it comes to sensitivity report, the sensitivity report, that is a report that tells you what type of medication will be most likely to kill the pathogen. So when you look at the sensitivity report, it will either say it'll either have an R for resistant, letting you know if you give this type of antibiotic, it's not going to work, it's going to be resistant, or it'll have an S for sensitive, letting you know if you give this type of antibiotic, most likely it will kill it. So the S, sensitivity, that is good. That lets us know that this type of medication will work. So if you're giving penicillin IM, and your patient's asking you, okay, why are we giving penicillin and not something else? You let them know, well, the sensitivity report shows that penicillin will most likely kill the type of infection that you have. That is the correct answer. 6 of you guys chose most viral infections respond well when treated with penicillin. That is a lie from the pit of hell, because let me tell you something. Penicillin is an antibiotic. How's it going to kill a virus? Antibiotics kill bacteria, so we know that can't be true. Next one, 6 of you guys chose penicillin as one of the safest, most effective antibiotics. Here's the thing, and NCLEX does this to you all the time, so I'm so happy this was an answer. This actually is true. Penicillin is one of the most, safest antibiotics. That is true. There's nothing wrong with the statement except for the fact it doesn't answer our question. We're not giving penicillin because it's a safe antibiotic. We're giving penicillin because a sensitivity report has shown that penicillin will kill the type of infection that the patient has. And let me tell you something, NCLEX does this all the time. They will ask you a question and they will give you a beautiful answer, but you need to make sure that that beautiful answer is answering the question that you're looking at, because if it's not, it's still wrong. Don't fall for it. And 6 of you guys chose, oh no, nobody chose all antibiotics are similar. Very good, very good. So anyway, I think you guys have a better understanding on the sensitivity report. Last question, guys, this was a very short Kahoot. This is a drop pin question. You choose to inject the prescribed dose of penicillin into the ventrogluteal site. Where would that be? Guys, take your mouse and drop a pin. I want to see if you know where you would administer this injection. You have to give it in the ventrogluteal site. Where would it be? Drop your pin. Show me. Show me where you would give that injection. Okay. Okay. So look at my mouse. I see 2 of you just dropped your pin right here. So you're going to administer this medication to air. You're not even going to give it to a patient. All right. Okay. For everyone else that decided to administer this medication to a patient, right? Let's look at these sites. Now, the first site, guys, 2 people chose the dorsogluteal. This is the dorsogluteal site. The correct site, the ventrogluteal site, is right here, right between the index finger and that middle finger. That's where the site would be, okay? A lot of you guys were off over here on the bones, right? But right here between this finger, that's where that ventrogluteal area would be. And then I see some of you guys chose the vastus lateralis. And last, this is the deltoid muscle. But when it comes to ventrogluteal, this is the correct answer. Right between that index and middle finger, that is where you would give that injection. And guys, thank you so much for joining this Kahoot. Let's see how you did.